Hello and welcome to Podiatry Weekly. My name is Dr. Kazak. I'm a practicing podiatrist in Northern California. On this episode of Podiatry Weekly, I would like to speak with you about how to know who will actually be performing your surgical procedure. Before you start on your surgery journey, you will meet many members of the surgery team, including the nurses, students, residents, surgical fellows, anesthesia doctors, and other people. Most people assume that you will be their surgeon who will be involved with all the aspects of their surgical care, but this is not always the case. So who will actually be performing your procedure? Well, depending on the setting where you have your surgery, for example, surgery center versus teaching hospital versus community hospital, or maybe you'll have it at the surgery clinic, your surgery may be supervised by your surgeon, but the scalpel could be actually held and operated by an assistant surgeon, medical or surgical students, residents, fellows, physician assistants, or nurse practitioners. In fact, some simpler procedures may be done by these medical providers without primary surgeon's direct oversight if they fall within the legal scope of practice of those individuals. Everyone expects that their surgeon will be in the operating room during the surgery procedure, and you usually meet this person much ahead of the surgery procedure during the preoperative clinic appointment. During your last clinic appointment, the surgeon or assistant staff will ask you to review the consent form, which should list the details of the procedure, including benefits, risks, and even potential complications. It is usually a fairly lengthy legal document that is meant to give you a summary of what the surgery and rehabilitation is going to be like. This is the perfect time to ask any additional questions and ask for clarifications. Once this document is signed by you and the surgeon can alert the operating room to plan your surgical procedure. In addition to explaining your procedure, the consent may list the names or job titles, or both, of other individuals that may be in the operating room and assisting or maybe even performing your surgery to a certain extent. So who are these individuals? Well, the first person could be the assistant surgeon. This could be a person who is as knowledgeable or even more knowledgeable with your procedure than your primary surgeon. This person is usually a surgeon in the same field and with the same level or increased level of training and familiarity with the procedure. This is particularly helpful if you're undergoing a revisional procedure and the assisting surgeon has done many of these types of surgical cases. There are other benefits as well. An assistant surgeon may advise on finer details of the surgical procedure and may recommend specific improved approaches and techniques. Surgery time may be shorter and the outcome may be improved with the use of a knowledgeable assistant like this. Other individuals may include medical surgical students, physician assistants, or nurse practitioner students. Who are they? Well, these are healthcare professionals in training to become doctors, surgeons, nurse practitioners, or physician assistants. They are not allowed to work on patients without direct supervision of a fully qualified or certified doctor, also known as attending doctor. If you're having your surgical procedure in a teaching or university-affiliated hospital, you're very likely to be assisted by these students. They're usually very friendly and eager to answer your questions about the surgery preparation, instrumentation used, and expected postoperative protocol, if they're well prepared. Hopefully, in your case, they will be. Unfortunately, they are ones of the least experienced members of the surgery team and tend to have a big picture understanding of what is involved, but not necessarily the details. They help the main surgeons with the logistics of the surgery and receive didactic and clinical training in return. What about residents and fellows? Well, residents are doctors who graduated from medical or podiatry school and have license to practice under supervision of another fully licensed doctor. Residents often work at university-based teaching hospitals. They are significantly more knowledgeable and skilled than the students, but are still considered to be in training. Residencies for subspecialties have different durations and can be from 3 years of length, like in the case of surgical podiatrists, to 7 years in the case of neurosurgery. The main surgeon should be in the operating room from the point of skin cut incision to the point of a patient being rolled out into the recovery room, of course. This, however, is not always so, and the residents may be left relatively unsupervised in the operating room based on the main surgeon's discretion and level of trust in residents' training. Residents in their last year of training should be very comfortable with performing surgical procedures, as they are about to become attending doctors themselves. However, a wise supervising surgeon will be there during the whole duration of the surgery, and you as a patient should request this. What distinguishes a very experienced resident from an attending doctor is the depth of knowledge that can only be acquired by experience. In surgery, complications arise all the time. Successful outcome, therefore, will depend on knowing not only on how to do the procedure, but more importantly on changing the course and quickly addressing the complications. Difficult situations such as bleeding, hardware breaking, instrumentation not fitting or working, changes in patient's medical stability and comfort, poorly controlled pain, and many other issues may arise during any time the surgery is happening, and they can also happen unexpectedly. This is why it is essential that a supervising surgeon is present and available through the whole surgical procedure. Fellows are known as super residents. They're usually fully credentialed doctors who can operate to the full extent of their license and training. However, these individuals choose to undergo additional training to get new skills or to deepen their comfort with already existing skills. In the world of podiatry, fellows are choosing to have additional training in the area of reconstructive surgery and trauma, sports medicine, pediatrics, research in limb salvage, as well as limb preservation. These fellowships may or may not be accredited. However, the main purpose of undergoing fellowship is to obtain an immersive, fast-paced subspecialty training experience. If there is a fellow surgeon or a surgeon who is a fellow assigned to do your surgery, you can bet that this individual will be doing the majority of your surgical procedure. If you're uncomfortable with this, you should definitely discuss this with your main surgeon. Training is an essential part of the process to become a fully fledged surgeon. If students, residents, fellows are not allowed a training venue, eventually we will run out of doctors, and nobody needs that. Thus, it's important to keep balance between the need for training and safety in patient care. Having surgery at a teaching hospital, of course, has its benefits, as these centers usually have access to the latest medical equipment, research, and technology. Therefore, if your surgery is for a rare condition, university hospital could be the best place for you to have the surgery. Surgeons that work with trainees tend to be at the forefront of latest technology and data within their field. This is because students, residents, and fellows tend to read latest research and are very inquisitive. This forces surgeons to be on their toes, so to speak, as they must stand up to date. Must stay up to date and constantly be aware of new skills and knowledge within their field. This increases the chance that inconsistencies will be spotted by these other members of the surgery team and complications will be avoided. So having students actually helps. Question arises, can you refuse the care by residents and students? Well, of course, absolutely. It is your right as a patient to be treated by the specialists and healthcare providers that you're comfortable with. If you do not feel comfortable with the care or with the care by trainees, then you should definitely mention this to your surgeon. This is best done during the preoperative appointment, but can also be done on the day of surgery. It is never too late, and your wishes as a patient should be respected. It is the job of the surgeon and surgery team to give you comprehensive education as far as the process of surgery is concerned. You may not want to know all the finer details of the surgical procedure, you may not be able to understand medical jargon, but you should be able to have all your questions answered and all your concerns addressed before going under anesthesia. This is part of the informed consent. So what about physician assistants and nurse practitioners? Well, there's a difference between a physician assistant or a PA and nurse practitioner or NP. Physician assistant is a highly trained healthcare specialist who is considered to be a physician extender. Therefore, these individuals can do any medical surgical task as assigned by the surgeon under surgeon's direct or indirect supervision. The extent of the involvement of the physician assistant specialist depends on their training, comfort with performing specific selected tasks, and also surgeon's assignment. In general, the more complex the assignment, the greater the degree of supervision required. Much of this, of course, depends on the surgeon-physician assistant professional relationship, trust, and skill awareness. Nurse practitioners are independent healthcare providers. They provide healthcare directly to patients without oversight of other healthcare professionals. They frequently work with other healthcare professionals as members of comprehensive medical or surgical team. Nurse practitioners are able to perform any surgical procedure to the full extent of their training. Who else is involved in your surgical care? Well, anesthesia doctor or CRNA is involved. Who is the CRNA? CRNA is a certified registered nurse anesthetist. Um, these individuals will usually meet with you in a preoperative area and will discuss how to make you most comfortable during the surgical procedure. In addition to intravenous sedation, monitored anesthesia care, and general anesthesia, you may be offered a regional block. In a world of podiatric surgery, these regional blocks and other blocks are frequently used and are very helpful. These may include various pain-reducing nerve blocks like spinal blocks, epidural blocks, blocks to lower limbs like popliteal and ankle blocks. Certified registered nurse anesthetists are nurses with advanced training similar to a fellowship. It's definitely an advanced degree, and are licensed to administer anesthesia under the supervision of the anesthesiology doctor. Operating room nurse and circulating nurse are also involved. Operating room nurse works closely with the surgeon during the operation. Operating room nurse may be wearing sterile attire and may assist the surgeon with retraction of tissue, intraoperative logistics, and instrumentation handling. Alternatively, surgical technicians are certified specialists who specialize in preparation and setup of surgical instruments and supplies in the surgery room environment. What do the circulating nurses do? Well, they are there to record the details of the procedure. This particular person is not necessarily dressed in sterile attire because they do not work within the direct surgical sterile field. They are available for troubleshooting devices and equipment and are important in surgical field setup. Having circulating nurse in the room allows sterile members of the surgical team to continue with the surgery case when additional equipment and setup becomes necessary during the course of the operation. For example, if the surgeon drops an instrument and a new sterile instrument is required, circulating nurse can obtain such an instrument. Another example is when blood may become necessary for transfusion. Well, a circulating nurse can make a phone call to the blood bank to request it. This can be done without having the surgeon interrupt the procedure. The last person that could also be in the room is a medical device company representative. This individual is never directly involved with the surgical care. Medical representative usually brings the instrumentation required for surgery from the medical device company. This person is educated and knowledgeable in the implementation and troubleshooting of the medical equipment used during the procedure. They act as a great resource for when surgery team needs an instrument that is unusual, or there is a concern with the instrument that's being used. Ultimately, it is your primary surgeon who is the captain of the ship when it comes to your surgical procedure. The responsibility for your successful surgical outcome is on your surgeon. Therefore, it is essential for you to be aware of all the members of the surgical team involved in your care. This is so you can communicate your fears, concerns, suggestions, and desires to your surgeon so that the most ultimate, the best possible outcome may be achieved, and you'll be well on your way to recovery. If you enjoyed this episode, please subscribe to this channel and share it with your friends and family members. And you can always find more information on my blog If you're interested, go to www.podiatryweekly.com. Appreciate your interest and speak with you soon.